Sarah Snead, Chesterfield's Deputy County Administrator for Human Services. Though the uncertainty caused by this pandemic is frightening, Chesterfield County employees are working tirelessly to ensure that all of our community members, no matter their personal situation, are given the resources they need to stay safe and healthy, both physically and mentally. If you're facing a mental health crisis, we're here to help. Chesterfield's Department of Mental Health Support Services remains in operation, though our buildings are closed to the public except for emergency appointments. Regular client appointments and intakes for new clients are being conducted by phone and through telehealth options. If you wish to begin outpatient counseling services, call 804-768-7318. If you're experiencing a psychiatric emergency or know someone who is experiencing an emergency, please call the crisis line 24 hours a day, 7 days a week at 804-748-6356. For more resources, visit the Mental Health Support Services webpage. Right now, many residents are facing financial uncertainty and with it, food uncertainty. Chesterfield Colonial Heights Social Services works alongside our state and federal partners to assist those in need through SNAP, the Supplemental Nutrition Assistance Program, and residents can seek assistance through the Chesterfield Food Bank and Feed More as well. However, our Department of Social Services needs your help. Our concern for residents in neglectful and abusive situations has increased due to community members staying in their homes and being more isolated. With less community visibility, we're asking if you see something, please say something by calling 748-1100, which is the main social service number, or 800-552-7096 for suspected child abuse or neglect, or 888-832-3858 if you're concerned about an elderly or disabled individual in our community. Though we've had to implement new safety precautions, our juvenile detention home continues to operate. Unfortunately, due to the risk of spreading COVID-19, we've temporarily stopped parental visitation for detained juveniles, but we assure you that the youth in our custody are safe and well cared for. As we all strive to cope with the stresses of social distancing and stay-at-home guidelines, we understand that those facing addiction and substance abuse face an especially daunting challenge. Our drug courts, a treatment alternative to incarceration, remain open, with operations now occurring virtually. In fact, all of Chesterfield's courts and correctional facilities have adapted their operations and safety standards to meet the needs of this moment. More information is available online as these organizations continue to do their work. Finally, I want to tell you about our Department of Citizen Information and Resources, which has been hard at work finding creative ways to engage vulnerable residents in our community, especially our older adults. For example, their Letters of Love campaign will ensure that volunteers create cards of hope and encouragement that are sent to nursing home residents as well as other shut-ins in our community. The youth at our juvenile detention home have played a huge role in creating cards for this campaign. In addition, the telephone reassurance program for elderly and disabled has been expanded to 7 days a week. So how can you help? Please participate in the Letters of Love campaign. And if you know of any Chesterfield County older adult who would benefit from a friendly reassurance phone call, please contact Aging and Disability Services at 804-768-7878 or email agingservices@chesterfield.gov. We are here to meet the needs of our community together, one conversation at a time. And it is in that spirit that we will overcome this pandemic. Chesterfield County is here to offer resources to those in need, but we must all act to increase our sense of community and solidarity as we face down the stresses and anxieties so common during this troubling time. I would be remiss if I did not thank so many of our partners in the community, our faith community, individuals, families, businesses, and nonprofits. So many of you are doing so much for all the persons in our community and all of your neighbors. Thank you, and please let us know what we can do to help you.